Happening today, vaccine advisors to the Atlanta-based Centers for Disease Control and Prevention will meet to discuss a significant shift to the childhood vaccine schedule.
Atlanta News First Don Shipman is live with the First Alert breaking news tracker outside CDC headquarters in Atlanta. And Don, they're meeting today and tomorrow.
So we likely won't find out the outcome to all of this until probably late tomorrow, if not over the weekend into Monday. But either way, public health officials are sounding the alarm on this. And the reason being is because this could change the schedule for the hepatitis B vaccine for newborns. This right here is what we already know about the schedule. Doctors usually give the vaccine at birth, but the panel could delay it weeks or even years. HHS Secretary Robert F. Kennedy Jr. handpicked these advisors after firing their predecessors. Kennedy claims money, not health, drives newborn hepatitis B vaccinations. Infectious disease experts say delaying the vaccine for even a few months will drive up infections and deaths from this disease.
We've seen tremendous reductions in childhood infections with hepatitis B, and this saves lives. Nothing has been shown that has any long-term consequences, and certainly nothing that has anywhere near the consequences of a chronic hepatitis B virus infection.
I think that the conclusion that we know that it is safe is perhaps premature.
So two public letters from former CDC and FDA officials are warning that top leadership at the HHS, which oversees the CDC here, is actually putting the nation's health at risk. That panel here at the CDC, they'll be meeting today and tomorrow. We're live outside the CDC headquarters here in Atlanta. Don Shipman, Atlanta News.